Welcome to Special Education with Hamid Naqvi। वाइवा की तैयारी हम जारी रखे हुए हैं स्पेशल एजुकेटर्स के लिए और ये छठा पार्ट है उस सिलसिले का। आज हम इंटेलेक्चुअली चैलेंज या मेंटल रिटार्डेड फील्ड के बारे में सवाल और जवाब करेंगे। फर्स्ट क्वेश्चन, डिफाइन मेंटल रिटार्डेशन। According to the Individuals with Disabilities Education Act, IDEA, mental retardation means significantly sub-average general intellectual functioning, existing concurrently with deficits in adaptive behavior, and manifested during the developmental period that adversely affects a child's educational performance. I repeat, according to IDEA, mental retardation means significantly sub-average general intellectual functioning, existing concurrently with deficits in adaptive behavior, and manifested during the developmental period that adversely affects a child's educational performance. What is general intellectual functioning? General intellectual functioning is typically measured by an intelligence test. Persons with mental retardation usually score 70 or below on such test, or at least 2 standard deviations below the mean on the normal curve. I repeat, general intellectual functioning is a typical measured by an intelligence test. Persons with mental retardation usually score 70 or below on such tests, or at least 2 standard deviations below the mean on the normal curve. What is intelligence? Intelligence came from Latin word intelligere, which means to understand. Intelligence is the aggregate or global capacity of the individual to think rationally, to act purposefully, and to deal effectively with the environment. This is what Weschler said. Intelligence came from Latin word intelligere, to understand. Intelligence is the aggregate or global capacity of the individual to think rationally, to act purposefully, and to deal effectively with the environment. What is IQ test? Terman adopted the system of calculating IQ using this formula. IQ is equal to mental age divided by chronological age multiplied by 100. Same being said here also, M is equal to mental age, C is equal to chronological age, and this test became the standard IQ test all over the world. Name intelligence tests. Modern intelligence tests are divided into two types. Number one is individual tests. One individual is tested at a time. And second is group tests. Group of individuals tested at a time. Explain individual test of intelligence. Verbal test, performance test. Two types of individual test, verbal test, performance test. Two individual tests stands out in measurement of intelligence. Standard Binet intelligence test and Wechsler-Beliver intelligence scales. What 5 factors the standard Binet intelligence test measures? Number 1, fluid reasoning. Number 2, knowledge. Number 3, quantitative reasoning. Number 4, visual spatial processing. And number 5, working memory. I repeat, Number one is fluid reasoning. Number two is knowledge. Number three is quantitative reasoning. Number four is visual spatial processing. And number five is working memory. What is adaptive behavior? It refers to an individual's ability to meet social requirements of his or her community that are appropriate for his or her chronological age. And it includes conceptual skills, social skills, and practical skills. Repeat कर लेते हैं. It refers to an individual's ability to meet social requirements of his or her community that are appropriate for his or her chronological age. Conceptual skills, social skills, and practical skills. What are conceptual adaptive skills? Mean three: language and literacy, money, time, and number concepts, and self direction. What are practical skills? Are activities of daily living, occupational skills, healthcare, travel, transportation, schedules, routines, safety, use of money, use of telephone. Repeat कर लेते हैं. Practical skills, occupational skills, healthcare, travel, transportation, schedules and routines, safety, use of money, use of telephone. Practical skills, activities of daily living. What are social adaptive skills? Social adaptive skills are interpersonal skills, are responsibility, self-esteem, gullibility, naivete, social problem solving, the ability to follow rules, obey rules, and avoid being victimized. Repeat कर लें जी. Responsibility, self-esteem, gullibility, naivety, social problem solving, the ability to follow rules, obey laws, and avoid being victimized. Social skills and interpersonal skills. ये हो चुका है जी. What is Wineline Adaptive Behavior Scale? What is Wineline Adaptive Behavior Scale? The Wineline is designed to measure adaptive behavior of individuals from birth to age 90. Usually involves obtaining information regarding the individual's adaptive behavior from a person or persons who know the individuals well. Repeat करें जी. The Wineline is designed to measure adaptive behavior of individuals from birth to age 90. Usually involves obtaining information regarding the individual's adaptive behavior from a person or a person who knows the adaptive well. Name 5 domains which Wineline Adaptive Behavior Scale measure. 5 domains. This is number 1 domain, communication domain, and there are 3 sub domains: receptive, expressive, and written. Receptive include attending, understanding, and responding appropriately to information from others. Expressive, using words and sentences to express oneself verbally to others. Written, using reading and writing skills. This is first domain. Second domain is daily living skills domain. It has again 3 subdomains: personal, which includes self-sufficiency in such areas as eating, dressing, washing, hygiene, and healthcare; domestic, performing household tasks such as cleaning up after oneself, chores, and food preparation; and third subdomain is community, functioning in world outside the home, including safety, using money, travel, rights, and responsibility. Socialization domain, this is another one. It has again 3 subdomain: interpersonal relationship, which include responding and relating to others, including friendship, caring, social appropriateness, and conversation, engaging in play and leisure, engaging in play and fun activities with others, coping skills, demonstrating behavioral and emotional control in different situations involving others. And next is motor skills domain. This is optional depending from case to case. Two subdomains, gross motor, which include physical skills in using arms and legs for movement and coordination in daily life, and fine motor, which include physical skills in using hands and fingers to manipulate objects in daily life. And another one, which is also optional, maladaptive behavior domain, internalization, which includes problem behavior of an emotional nature, externalization, which include problem behavior of an acting out of nature, and critical items, which include more severe adaptive, maladaptive behaviors, do not form a unified construct and therefore are not scored as scale. Explain degrees of MR, mental retardation degrees. Mild mental retardation IQ between 55 to 70. Moderate mental retardation IQ between 35-40 and 55. Severe mental retardation IQ between 20-25 and 35-40. And profound mental retardation IQ between 20 or 25. The source is AAMR, American Association of Mental Retardation. What is Down syndrome? Down syndrome, it is a common birth defect that is usually due to extra chromosome 21, trisomy 21. Down syndrome causes mental retardation, a characteristic facial appearance, and multiple malformations. It occurs most frequently in children born to mothers over age 35. Repeat कर रहा हूं जी, a common birth defect that is usually due to an extra chromosome 21, trisomy 21. Down syndrome causes mental retardation, a characteristic facial appearance, and multiple malformations. It occurs most frequently in children born to mothers over age 35. How is Down syndrome detected? Diagnostic tests that can identify Down syndrome include chronic villus sampling. In CVS, cells are taken from the placenta and used to analyze the fetal chromosomes. This test is typically performed in first trimester between 10 and 13 weeks of pregnancy. How does Down syndrome affect a person? Common physical signs of Down syndrome include decreased or poor muscle tones, short neck with excess skin at the back of the neck. Can Down syndrome be cured? Down syndrome cannot be cured. Early treatment programs can help improve skills. They may include speech, physical, occupational, and or educational therapy. With sport and treatment, many people with Down syndrome live happy, productive lives. What is ASD? ASD it is short is autism or autism spectrum disorder, is a complicated condition that includes problems with communication and behavior. It can involve a wide range of symptoms and skills. What are common symptoms of ASD? Lack of eye contact, a narrow range of interest or intense interest in certain topics, doing something over and over like repeating words or phrases or rocking back and forth and flipping a lever, high sensitivity to sounds, touches, smells, and sights that seems ordinary to people, and it continues not looking at or listening to other people, not looking at things when another person points at them, not wanting to be held or cuddled, Problems understanding or using speech, gestures, facial expressions, or tones of voice, talking in a sing-song, flat, or robotic voice, and trouble adapting to changes in routine. Stable SG